Hi everyone, I'm Wahinya Doc. In this video, I'm going to discuss sinusitis. We are going to learn what is sinusitis and signs and symptoms of sinusitis and everything about sinusitis. If you like this video and benefit from it, hit the like button, comment below, share, and most important, subscribe. What is sinusitis? Sinusitis is the inflammation of the lining of the paranasal sinuses. What is a paranasal sinus? A paranasal sinus is a small hollow spaces that are found in the bone that surround your nose cavity. There are four types of sinuses. These sinuses we have there's a diagram here which I'm going to show you what are paranasal sinuses. There are two diagrams. One diagram is the front view. In this diagram, I'm going to show you, this is what we call the maxillary sinus. The maxillary sinus, we have the right maxillary sinus and the left maxillary sinus. The maxillary sinus is found around the cheekbone. Then we have the ethmoid sinus. The ethmoid sinus, we have the right and the left ethmoid sinus. The ethmoid sinus is found beside the upper part of the nose. Then we have the frontal sinus. Frontal sinus, we have the right and the left frontal sinus. The frontal sinus is found in the lower forehead. Then the fourth sinus, I'll show you through this diagram. This is the side view of the skull. We have the fourth one, which is the sphenoid sinus. The sphenoid sinus is found behind the nose. It's found in a bone we call the sphenoid bone. What are the functions of these sinuses? These sinuses, as you have seen, they are small hollow spaces that have their openings. Their openings, they are opening into the nose cavity. So these sinuses have around four functions. One of the functions is that they usually humidify and heat the air you breathe in. That is one of the functions. Another function is that they usually increase the resonance in your speech. When you have sinusitis, you usually have a speech that is like coming from the nose. Utasikia watu wakisema ni kama anaongea na mapua. That is when you have sinusitis. That is the cause of that nasal speech. Then the sinuses also have a function that deal with the secretion of the mucus. They usually have a lining that secrete mucus into your nose cavity, and also the sinuses also have another function which is protection. They protect the vital organs from damage in case you have face trauma. I'll give you an analogy of a motor vehicle. A motor vehicle usually has the front part of a motor vehicle is usually designed weak. It is designed weak so that in case of an impact, this front part will be able to absorb the impact by folding or getting damaged. So these sinuses, they make this front part of the skull weak. So in case you have a very severe or blunt face trauma, these bones will absorb the impact or the force of the impact by getting damaged, so that your brain might not get injured. From there we have What are the four types of sinusitis? Sinusitis exist as acute sinusitis. We have subacute sinusitis, and also we have chronic sinusitis, and the last one we have recurrent sinusitis. Acute sinusitis is when you have the duration of the signs and symptoms of sinusitis. The duration is 1 to 4 weeks. For subacute sinusitis is when the duration of the signs and symptoms of sinusitis are from 4 weeks to 12 weeks. Chronic sinusitis is when we have long-lasting signs and symptoms that go beyond 3 months. Then we have recurrent sinusitis, where we have a recurrence of sinusitis 4 episodes per year. What are the signs and symptoms of sinusitis? Before we discuss the signs and symptoms of sinusitis, I want us to discuss what is the difference between signs and symptoms. The difference between signs and symptoms, one is that the signs they have an eye, and the symptoms have Y. I in signs means that I, the doctor, will be able to discover the signs. It's what I'll be able to when I examine a patient, it's the what I'll find from you. Then the Y in symptoms is what you'll be able to describe. The symptoms you'll be able to describe or tell me. Those are the symptoms. So I'll start by the symptoms of sinusitis. One, we have nasal discharge or nose discharge. This discharge will be thick, yellow or greenish. Then we have a postnasal drip. Postnasal drip is when the discharge from the nose is draining into the down into the throat. Then we have anosmia. Anosmia is when you lose the sense of smell. Then we have nasal congestion or nasal blockage. Then we have cough. Cough is as a result of the postnasal drip. Then we have facial pain or pressure. You might be feeling around pain around the face or pressure around the face. Then you might also experience headache. Headache especially become worse. Headache become worse when you are bedding forward or when you are lying down. Then we have other symptoms like fever, fatigue. You might be feeling a lot of fatigue. Then what are the signs that you will experience? One of the signs that you will experience is that all of the signs that I'll be able to elicit from you, you might be feeling pain around the cheekbone. The pain is radiating to the lower forehead, or it is radiating to the upper jaw. Then you might be having readiness over the cheekbone, readiness over the beside the nose, and also readiness around the lower eyelid. Then you might be, when I examine or try to pressure this area or to touch, you might be feeling a lot of tenderness over this region around the nose, the cheekbone, and the lower forehead. Your sputum will be greenish, thick. It may be also be yellowish. It also may contain blood. Then we have bad breath. Sinusitis is a cause of bad breath. What causes sinusitis? When you have inflammation of the mucous membrane that is lining the sinuses and the nose and the throat, this will you'll have inflammation of those mucous membranes. This inflammation will result to swelling. The swelling will block the exit or the opening between the sinus and the nose cavity. When you have the blockage of this opening, mucus will not be able to drain normally from the sinuses into the nose. So this is what will contribute to your sign and symptoms. That is facial pain and all those other signs that we have talked about. Then causes are classified into two. We have infectious causes and non-infectious causes. Infectious causes, we have viral infections. Viral infection is the most common cause of sinusitis, especially rhinovirus. Rhinovirus is the most common cause of common cold, and common cold is the most common cause of sinusitis. Two, we have bacteria. We have bacteria like Streptococcus, Moraxella catarrhalis, and also we have other bacteria like Haemophilus influenza. That we have fungal. Fungal infections might also cause sinuses. We have non-infectious causes. Non-infectious causes, we have smoking. Smoking usually damages the cilia that is found in the mucous membrane that is lining your nose cavity and your respiratory tract. Then we have a toothache. A toothache is when you have an infected tooth. This tooth will spread the bacteria to the sinus and resort to sinusitis. Then we another non-infectious cause is that we have other conditions like asthma, cystic fibrosis, and HIV. We have number four. We have nasal polyps or nasal tumors. These are growth that can occur inside your nose cavity. And how is sinusitis? How is sinusitis diagnosed? Your doctor will ask you questions about your signs and symptoms. Also, your doctor will do a physical examination on you to find other signs of sinusitis. Your doctor might also ask you to do certain lab tests and also might ask you to do certain imaging studies like X-rays and CT scan of the sinuses. How is sinusitis treated? Most cases of sinusitis are mild and self limited. Self limited means that this you can be able to recover on your own without having or taking medications. Other cases might be severe, and these cases will need prescriptional medications. Also, they will need alternative therapies, and also there are supplements that can be able to help you in case you have those conditions or chronic sinusitis. What are the complications of sinusitis? Complications of sinusitis, we have one, these infections of the sinuses. As you have seen in this diagram, we have this sinus, which is the maxillary. This is the maxillary sinus of the upper jaw. It is located in the upper jaw, and we have the frontal sinus, which is located in the frontal bone. We have this diagram is not showing well, but we have the ethmoid sinus. The ethmoid sinus is located in the ethmoid bone. Ethmoid bone is located beside the nose. Then we have sphenoid sinus. Sphenoid sinus, we have said, is located in the sphenoid bone or behind the nose. So when you have an infection in this location, one on this location, this infection might cross over to the brain. In the brain, when this infection cross over to the brain, it will cause two things. One, you might get what we call meningitis. Meningitis is the infection and inflammation of the layer, this layer that is covering the brain. So that is a very bad complication. Two, you might get a brain abscess. Brain abscess is a boil. It's a boil that is forming inside your brain. It's a very serious case. Then we have other Other complications like otitis media. Otitis media is the infection of middle ear. We have eustachian tube. Eustachian tube is located here. Eustachian tube connect the nose cavity to the middle ear. So in case you have an infection around the nose or an infection around the sinuses, this infection will spread to the middle ear, resulting to, to otitis media. And last, we have the infection of the sinuses can also cause you to have other conditions, like it can contribute you to have other conditions like asthma. If you like this content, you can follow and subscribe Wahinya Doc. This is the content we produce. We make medical very simple for you. Thank you.